A North Vancouver woman is speaking out about what she calls a lack of support for those facing fertility issues.
It's putting so much more stress on a woman who is already in a very vulnerable, delicate situation.
Why advocates say more needs to be done to improve fertility care in BC. After months of struggling to conceive naturally, a North Vancouver woman is speaking out about what she calls a lack of support for those facing fertility issues in BC. So Rab Sandhu reports.
38-year-old North Vancouver resident Lucina Khachatrine and her husband are planning for their second child. After an initial consultation with her family doctor, Khachatrine was referred to a gynecologist who wrote her a referral for an HSG test.
It's basically an X-ray test that is done to check the size, the shape, and the patency of the fallopian tubes of a woman.
She says securing an appointment for the test has been next to impossible.
When I was asking how many women call per day, they say in average 15 women. And it's very frustrating for them to have to reject all these women. But then when I asked how many procedures are performed per day, they said just 1 or 2.
Lucina says the test cannot be pre-booked and testing has to be done within first 10 days of a person's menstrual cycle, leaving a slim window to get the test done.
I've been trying to call every day on the first, the first day that I see my period, and I call to the hospitals, Lionsgate, UBC, Abbotsford, Chilliwack.
This reproductive rights health expert says BC lacks support for people struggling with fertility issues. She says globally 1 in 6 experience fertility issues.
We're seeing a very hard time to get medical tests, to get heard, to be in the queue, to get into the system. We're not looking at 3 to 6 months. We're looking at a year, 2 years before you can even get some answers or clarity.
CBC News reached out to local health authorities for comment, but did not hear back by the deadline. For people like Khachatrine, time is running out.
Everybody is frustrated. Seems like everyone wants to be helpful. I also don't see any combined, collective action to improve the situation.
Because of that big stigma, there's not big groups of people pounding on legislative doors and picketing and sending letters to their MLAs and politicians and advocating for this.
Khachatrine says she is considering going to Alberta for the fertility test, where she says appointments are more readily accessible.
Not being able to secure a common test that is just 30 minutes long is putting so much more stress on a woman who is already in a very vulnerable, delicate situation.
She hopes before she is forced to travel out of province to get the care she needs, BC improves access to fertility care. Rab Sandhu, CBC News, North Vancouver.